Hey guys, in this video I will be discussing public health activities in British Columbia that directly and indirectly relate to the fentanyl crisis. This content is pretty heavy, so bear with me. I'm sure you guys will learn a thing or two towards the end. So here we go. British Columbia does not currently have a coordinated, comprehensive, and effective population and public health surveillance program for problematic drug use and harms, in the same way that it has such programs for communicable diseases surveillance systems. However, in July 2016, during the British Columbia Overdose Action Exchange Report, they discussed the need for comprehensive inter-sectoral solutions to implement policies, programs, education, enforcement, surveillance spectrums to address the overdose crisis, as well as, the determinants of health and well-being that contribute to this crisis. During this meeting, 12 key actions were identified to have an immediate effect on the overdose deaths. These 12 actions are, bear with me, number 1, enhance data linkages and the use of surveillance information across sectors, timely information sharing with frontline workers, decision makers, and people who use drugs. 2, launch a targeted provincial public awareness campaign. 3, expand naloxone availability to reduce and reverse the overdose. So this is for first responders, ER departments, frontline workers, family and friends, people at risk for the drug use. Number 4 is increase provincial supervised injection services capacity. So more injection sites available in the cities or where there is the high risk of this incidence. Number 5, develop capacity for improved street drug checking and drug sample analysis. Number 6, expand access to substitution treatment for opioid use disorder. So first-line agonist therapies, methadone, alternate opioid replacement therapies, for heroin and what have you. Number 7, grow key preventions and treatment services. So this includes addiction treatment, withdrawal management, mental health services, pain management, treatment programs, and services. Number 8, facilitate more appropriate prescribing and dispensing by healthcare providers. So we need a better use of the PharmaNet and guidelines for starting, managing, and tapering off. Number 9, we need to collaborate with law enforcement, approaches, and drug policies. So we need safe pharmacies, pill presses, and good Samaritan law to be enforced. People will be scared of police getting in trouble, going to jail for approaching on an overdose. So we don't want that. Number 10, we want to improve access to harm reduction services in correctional facilities. So in-home services and support in translation back to the community. Number 11, we want to empower service providers with the knowledge, tools, resources, education in mental health, substance use, and trauma-informed care. Finally, number 12 is developing a comprehensive cultural shift strategy. So this includes stigma reduction towards people who use drugs, positive attitudes towards harm reduction. So British Columbia has actually started to implement some of these programs that target this fentanyl crisis directly. An example of these programs they include, and I will just discuss 3. The first one is the take-home naloxone program. So this provides training kits that antagonist naloxone to individuals at high risk of overdose. So these include people, recurrent drug addicts, drug users in shelters, individuals who tend addiction clinics, family members, people in the community to have these kits. So if they see someone that could be overdosing, they can give this drug to reverse the effects of the drugs, bring up their respirations, get them to a hospital, get them seen and helped out. The second program I want to talk about is the SACI. So SACI in Vancouver, it's a school-based initiative to create public awareness campaigns and messages regarding fentanyl. So this includes handouts, posters. They also have on their website videos, worksheets, and it is an indirect public health activity used as a primary prevention approach to the fentanyl crisis. This is targeting children and parents, people in the community, teachers, people that can advocate and develop that awareness around this crisis. The third one I'm discussing is another direct public health activity. This one is for first responders. This is a 2-day workshop for them. Day one would include police, paramedics, firefighters, border guards, etc. They will focus on the dangers of the drug and its derivatives, as well as toxic substance. The W18, addressing safe handling and issues encountered at one overdose scenes. Day two, they limit to drug investigations. They will cover fentanyl, the importance of fentanyl, the processing, the packaging, the pricing, the distribution, with the focus on, British Columbia trends. Officers who attend both days, they will receive a certificate, which will advance their qualifications to give evidence-related fentanyl trafficking in court. This is very important. There has been many crises where the drug has been shipped in, people are touching the drug, and it is highly concentrated with fentanyl, and even a skin contact with it can be enough to put someone in an overdose effect. We don't want that. So these are a few activities that public health has initiated to help control the crisis at a manageable level. Many others are in the process of starting and continuing, but we still need to focus on these. We still need to go back, evaluate, see how well they are, and what we can do to improve. Hopefully you learned something. Take care.